So number 4, we have a mental health question. The nurse is observing a staff member who's caring for a client who has schizophrenia and is experiencing auditory hallucinations. Which of the following statements by the staff member to the client would require the nurse to intervene? Okay, so again, a lot going on in that header and stem, right? So we've really got to read carefully to figure out what we're looking for. So in this case, we're looking for the statement that would cause the nurse to intervene, which means we're looking for a statement that would be inappropriate, right? Okay, so 3 of these are going to be correct and 1 is going to be inappropriate, and that's the one we're looking for. Before we do that, let's take a second to remind ourselves what we know about communicating with clients who are experiencing psychosis, because there's a few things that are going to be a little bit different, right? So I think it's easier to start off with the things that we don't want to do. So the biggest things that we don't want to do is we don't want to refer to hallucinations as if they are real. So we don't want to say like, what are the aliens saying to you? Where are the spies at? Why is that person trying to kill you? Like, we don't want to also convey to the client that we think that their hallucinations are also real, because it's going to reinforce that psychotic content for the client and make it feel even more real for them. But on the same hand, we also don't want to negate the client's experience. So we don't want to say things like, nobody's trying to get you, that's not what's happening, nobody's trying to poison you, because we have to remember that what the client is experiencing feels very, very real to them. So if we come in there and say, that's not what's happening, that's not real, nobody's trying to hurt you, they're going to feel dismissed, they're going to feel really suspicious of us, they're not going to trust us, and it might even make them really kind of agitated. So you might be asking, okay, well, if I can't go along with it and I can't tell them that's not what's happening, what do I say? So what we do is we make neutral observations. So we offer our own perception of what's happening. So we could say things like, I don't hear any angry voices, or I see Dr. Smith at the nurse's station, but I don't see any evil aliens. You know, I see Dr. Smith. And then we also want to acknowledge how the client's feeling. So we could say things like, I don't hear any angry voices, but that sounds really upsetting. That must be really frightening. That sounds really scary, because it is, right? So we want to acknowledge how that's making the client feel, okay? And then we follow that up by engaging them in things to distract them away from those hallucinations. So we might engage them in distraction, like playing a card game, doing a simple art project, because what we don't want to do is leave them sit alone with those delusions or hallucinations, because it's going to allow them to just get more and more wrapped up in that content. So we want to engage them in some reality-based activity that's simple and concrete. Now, if the client has some insight into what's going on, has some insight into the fact that they might be experiencing a hallucination, we can engage them in reality testing. So we can say things like, let's look around. Does anybody else seem to be hearing what you're hearing? Does anybody else seem to be fearing for their life? Do they seem to be seeing what you're seeing, right? So kind of just prompting that observation. We're not telling them that it does or doesn't exist. We're just saying like, hey, let's look around, right? We can also do things like competing auditory stimuli. So for auditory hallucinations, we might do things like turn on some music, engage them in conversation, turn on the TV, because it's really hard to attend to both internal stimuli and external stimuli at the same time. So it can help distract them from those hallucinations. If they're also experiencing auditory hallucinations and they have some insight, we can also help them tell the voices to go away. That has been a proven technique to help clients feel more in control of their symptoms. So with that in mind, let's go back to our question and see if we can answer this and figure out which of these would be inappropriate. So our first one is, why don't we go listen to some music together? Would that be appropriate for a client who is experiencing auditory hallucinations? Yeah, absolutely, right? Because that's going to help distract them away from those auditory hallucinations. All right. What about, let's go play a card game with the rest of the group? Is that appropriate? Yeah. That's also a good form of distraction, right? We don't want to leave them sit alone, like listening to these auditory hallucinations. So we want to get them engaged in a reality-based activity. Okay, and then number 3, I will help you and together we can tell the voices to go away. What do you think? Yeah, that could help them feel more in control of those hallucinations. And we don't have any reason to believe up here that they do or do not have insight, right? So if they did have insight, we could certainly have them do that. That might be helpful in decreasing those auditory hallucinations. And then number 4, What you're hearing is not real. You are experiencing a hallucination. I think this often trips students up because we're like, oh, we're reinforcing reality. That's a good thing, right? But remember, it's a little different with clients with schizophrenia or psychosis, right? Because we don't want to directly negate that experience, right? So this, we know, would that be appropriate? No, right? Because we don't want to directly negate that hallucination. Now, even if we didn't know that number 3 was appropriate, because that is a little bit more advanced, we definitely would know that this is inappropriate, right? So that would help us choose our answer. Should we see if we're right? And yes.